Hi there, bonjour from Montreal. I'm Dr. Nastia Petkova, a family dentist with 20 years of experience. Today I will talk about gum disease. Do you know that every one of two person has a gum disease? This is something that is very often ignored and also not taken in consideration. I see a lot of people, of my clients, that have a gum disease in a different level of progression, and I try to explain and to inform them of the consequences it can have this kind of disease for a long term. It's some kind of like chronic disease like diabetics or high blood pressure. But because it's in the mouth and because there is not a very active symptoms, and it's very difficult to pay attention to, it's more your dentist that can inform you about this, or if you notice sometimes when you brush your teeth that there is a bleeding of your gums. But this is a very silent disease, but unfortunately the results from the long-term progression are really bad, and you can lose a safe tooth without cavity needs to be extracted, just because the bone that supports your teeth is infected and is not in a good condition. So I will just make a small review again. What is a gum disease? Gum disease are disease that are affecting the support bone of your teeth. And it starts very slowly. In general, when you not brush your teeth for a couple of days, the food starts to get stuck on the tooth surface, and there is microbes that starts to become more and more, and also the food become harder, and it's like a rock fixed on your tooth. And unfortunately, just brushing or passing a floss, it will not, unfortunately, remove this hard deposit of the calculus over your teeth. You need a special cleaning. This is a professional cleaning in the dental clinic with a special devices. In general, we use the ultrasound devices that will split all this hard, like rock food residue on your teeth in the small particles that will remove very easy. And then, because when we work on the tooth surface, the tooth surface, we need to make it more smooth as possible, so that the gum tissue can stack over and become solid. But that's why after we do a professional cleaning with the ultrasound appliances, we use a special manual instrument, special curettes, that we manually trying to make the enamel of the surface as much smooth, so that the healing gum tissue can really attach and marry the tooth surface. But if you don't go for a professional clinic at least twice a year, if you don't have a gum disease, if you have a gum disease, you need to go more often, every 3 months or every 4 months, so that the food is not so hard and difficult to remove. So if you not go for a professional clinic, unfortunately what happens is that this calculus start to grow, and it's forming around your tooth like a bag, very hard and difficult to remove. Also, your tissue, which is closer to this full of microbes calculus, don't want to get in touch, in contact with. So that's why we have to have a small splitting all around the tooth of the gum tissue. The gum tissue is attached to the bone. So when the gum tissue starts to detach from the tooth, the bone also starts to resorb, and you start to lose slowly the bone support. And when you go to your dentist, for example, for your recall exam, what happens is that your dentist has special instruments that measure 6 places around every tooth in your mouth to see if you have what we call the gum pocket. Gum pocket is exactly this process what I explained, that when there is a lot of calculus around the tooth and gum tissue starts to detach, it starts to form what we call pocket. There is different level of depth of the pockets. In general, the normal depth of healthy tissue is around 1 to 3 millimeters. But when it starts to grow and it come 4 and 5, we start to discuss that this is the beginning of the gum disease. When you go to your dental clinic and checkup, in general, you can see the doctor said that there is a code of 1 or 2 or 3. So these are all codes for our profession, that we know what kind of level your gum disease or your gum are healthy. So if you hear 1 or 2, it's really good. But if you start to hear 3, 4, 5, these are not good, because the more the digits bigger are, the more means that your gum disease is in progression and it is under control. And this needs to have more regular and more often cleaning every 3 to 6 months. So when the gum pockets progress very, very advanced, it can be reach even 10 millimeters of depth. And this means that the tooth is already traveling to be extracted, because there is really nothing left around the root surface, the root of the tooth, and the tooth become mobile. That's why I will explain the other interesting symptom about the gum disease. The gum disease we call also the silent disease, because it's progressed very slowly. There is no active symptoms, but after years you start to see that your teeth start to have more space, like they start to flaring, and to have more space between them. Also, some teeth starts to be more loose, more mobile. This is because the bone is infected and you didn't go for taking care of the gum disease, and because of the pressure, the teeth starts to lose their support and to lose the contact between each other. And that is the other thing, that the gum disease for a long term can change your occlusion, the way you close your teeth, also the way you chew. And this can give another consequences on your temporomandibular joint, which is here when you open and close, because the teeth don't have a good support, that the bone is not healthy, and the occlusion contacts with the upper and lower teeth, how they close change. It starts to make you a pain in your temporomandibular jaw, and when you open, when you close, when you chew some foods, you can also start to have like symptoms of crunching or a noise from your articulation here. So I will just summarize again how the gum disease progresses. It starts on the surface, just on the gum, and then when it progresses, the gum starts to detach more and more of the tooth surface and starts to create what we call the gum pockets. The gum pockets have different depth depending of the degree of progression of your gum disease. So the less the pocket depth is, the less fast progress your gum disease. And also we have in consideration another two things. If when we do exam around your tooth on the 6 places what I said, if we have a bleeding and if we have accumulation of the tartar or the bacterial plaque, these are also two factors that indicate if you reach well the surface to brush it and to clean it well and maintain a good oral hygiene, or it's a surface where you have difficulty to reach and it's difficult to maintain the oral hygiene. So that there is like surface which is more prone to keep microbes and to keep source for infection for your gum disease. And especially these areas are more on the back teeth, where we don't have very easy access and where we not really have a good manual angulation of the toothbrush. That's why we in general use a special small toothbrushes that help, especially on the back teeth area, to clean around them, so that they don't become a source of microbes that spread around all the other areas where it's easy to brush. And also, it's a very interesting thing I will share with you. In general, when people have a gum disease, they start to have a very specific mouth breath, which is not nice to smell. But what I notice is that people get used to, and they start not to recognize it. But also, and the other thing that you can notice when people start to have more gum disease is that because gum shrinks, teeth starts to become longer. And also you can see even the root which is exposed, that when the gum shrinks, the roots of the teeth starts to become visible, which normally is not the case. And what is very, very specific is when the gum shrinks and the root starts to be exposed, you can see the big dark triangles between the teeth. This is also another sign of active progressing gum disease. So this is in general how slowly the gum disease takes place. The bad thing is that we cannot go back and recover the bone that we lost, unfortunately. And what is the purpose to treat the gum disease is to keep it under control. It's like diabetics. You need to take regular your pills to measure your blood pressure to see that your diabetics disease is well controlled. The same thing is for the gum disease. The dentist's purpose is to control your gum disease and to help you maintain a good habits and good oral hygiene. And this includes first step, which is a special deep cleaning, what we call, that we need to go really under anesthesia into the depth of the gum pockets to clean, irrigate and disinfect well the area. The second thing is that we need to teach you how to use the good tools to do a good technique of brushing, the good use of all the tools necessary that you keep, even in the difficult areas, the clean teeth. And then we have the protocol and the system that we use to maintain and to control your gum disease. The most often is that you need to see your dentist every 3 months for a checkup, for a dental special checkup, and for the gum checkup, and also to do a cleaning, to revise your technique for brushing, to revise the tools that you use, the Waterpik or the electric toothbrush or a special manual toothbrush. So these are things that we do through the treatment plan and through the process of healing your gum disease. We try to cure it and to recover the normal gum tissue so that you don't have gum pockets, that your gums are not bleeding, that you don't have a bad breath from the mouth, and also that you don't accumulate a lot of tartar and bacterial plaque, and that you're able every day to remove it so that the gums are really healthy. This will prevent a lot of complications in the future, because when you have a bleeding gums, when you have a gum disease, there is a lot of microbes going in your body through the blood system. They can go in your internal organs, even in the brain. So it's proven, the studies is clear that gum disease are related to a disease like Alzheimer, like high pressure, like diabetics, that are all related because the gums are your door microbes, the let's say like this, gums which are not healthy are the door for the microbes to progress and to go in your body. Please subscribe and share and write your questions. I will be more than happy to answer all of them. Thank you very much for your attention and have a great day. Au revoir from Montreal.